Hello everyone, and welcome to the third webinar in the CCI Loves HR series. Today's webinar is called Workplace Safety and Health Considerations for the HR Professional. My name is Karin and I'm the manager of CCI's Safety and Risk Services team. My role at CCI includes a variety of policy positions in relation to workers' compensation and occupational safety and health, including being a member of the WorkCover WA board and the Commission for Occupational Safety and Health. Also in my role, I provide advice, support and services to employers directly on site and give them assistance in preparing and implementing safety and health risk management processes. I also provide legal advice under CCI's legal service arm called Business Law WA. By the end of today's seminar, you'll have an understanding of the scope of changes to occupational safety and health laws that are scheduled to come into effect in WA early next year. You'll also have an understanding of how you can assist your executives and senior management team to implement the changes effectively. And you will have a to-do list to take away and action. There is large-scale legislative change planned for Western Australia. And it's really important as HR people that you are aware of the changes because they aren't only relevant to safety and health professionals, they also apply to lots of different areas of your business. And as a person within the human resources area, as most of you are across the organisation as a whole. And many of the new pieces of legislation that will be introduced or the alterations to existing legislation will impact on how you operate on a day-to-day level and how well your organisation can respond to changes. So there are many changes on the agenda, and the reason that safety and health remains a priority area for legislative change is because of the sobering statistics that still exist, even despite the very good efforts made by many employers, regulators and others to prevent and reduce the impact of injuries. In Australia, there is still a fatality around once a fortnight in every workplace, or in workplaces around the states there is a fatality once a fortnight. There's also an injury every 20 minutes in a West Australian workplace that results in a person requiring 10 days or more off work. So these are serious injuries that we're talking about. So these statistics continue to drive an interest in legislative change in this space. So the main areas of change include a harmonisation agenda, which is one that was introduced in 2008 as part of the COAG process, to look at ways of creating uniform or consistent legislation around the country so that safety and health laws can be applied by all businesses no matter where they operate. We are now at a point where only Victoria and WA haven't yet introduced a version of model work health and safety legislation. But we are also at a very exciting time now in that Western Australia finally has introduced a draft Work Health and Safety Act, which is the model version. One major point of difference to note is that with those changes there will potentially be a vast increase in the types of regulation that exist if we were to adopt the entire model package as it has been drafted. So that's something to be aware of because there will likely be changes to the detail in how business is run and how work is completed. There is also a completely new statute being drafted for workers' compensation in Western Australia. It's anticipated that this will incorporate more than 180 changes to the current way that workers' compensation is legislated in WA. Resources safety is another area that is currently being reformed, and there is a very large agenda of work there to try and create a new system that incorporates a variety of different areas of safety legislation in that space. So it's expected that every business is going to need to allocate about 12 months to understand and implement changes that might come in across those three areas as relevant depending on what kind of work you do and what kind of industry you are in. So besides having specific responsibilities in the HR space if you are a HR professional, the work that you do is critical to the success of safety and health and workers' compensation outcomes because you play such an important role in implementing HR policies and supporting managers in managing the workforce. This is particularly relevant in relation to staff engagement, staff education, executive education, recruitment and retention, discipline and termination, and employment, workplace, health and wellbeing programs. All of these things overlap with occupational safety and health and can significantly impact how well you will be able to achieve a safe and healthy workplace. So what is it exactly that we're talking about when we're talking about occupational safety and health, and how is it relevant to you when you are managing people? Occupational safety and health is interchangeable with the term occupational health and safety, which is essentially interchangeable with work health and safety. So these acronyms over time have become representative of the same thing. And on a practical level, it's the management of work and the management of people. So the critical question when you're considering an employer's duty of care is, have you done what is reasonably practicable as a business and as an individual to provide a safe and healthy workplace? So that leads us to the question of how much is enough when it comes to people management in the context of risk management. As we can't be everywhere at once, supervising everyone and everything, we rely on people to make good decisions. Unlike machines, people are unpredictable. There are times when they will make exactly the right decision, and other times when they'll make completely the wrong decision. Managing the variables associated with decision making by the workforce is definitely an OSH matter and a people management issue. Are the right people with the right decision making skills and instincts being recruited? This is definitely an HR question. And some experts are suggesting that HR recruitment processes should include testing for thrill-seeking behaviour to minimise OSH risks. That should make for very interesting recruitment type questions. If safety and health aren't managed well at the workplace, the outcomes can be very noticeable. In particular, you can have injuries, illnesses and death at the workplace, and the flow-on effects from these outcomes include prosecution, reputation damage, recruitment and retention difficulties. Very often the early signs of poor safety and health management can be addressed by having improved communication, education and upskilling of managers and supervisors with responsibility for work areas. Bigger and longer term activities can include workforce planning using profiling and predictive analysis. This is again where you're seeing the overlap between human resources approaches and ways of managing safety and health risk at the workplace. These kinds of activities sound quite simple and very effective from an OSH perspective, and sometimes what happens is that the safety professional will say, in order to reduce the risk, we can no longer have this person in the workplace. But for those of you who work in human resources, you will know this is not as easy as it sounds. To be able to remove a person from the workplace is actually a very delicate operation if you are required to meet a variety of employee relations obligations. So the overlap here really places a strong reliance on human resources structures and processes and people with the right skill set to recognise the competing priorities there. So the other thing to bear in mind there is that it can be very difficult sometimes when you're making decisions from a safety perspective to not overlap with employee relations or industrial relations obligations. And it can also particularly be difficult to avoid claims of discrimination and other adverse IR outcomes along those lines. So another point today to bear in mind is that there really is a very intricately related requirement that both you in your HR role and your occupational safety and health staff are working together to make sure your messaging is consistent, your systems are complementary to each other, and that you are able to work together to achieve the outcome you're looking for, so that one person going down one path doesn't suddenly get pushed into another direction by a different requirement. The other thing from an HR perspective in terms of the kinds of roles that HR staff play, it is becoming more and more common and expected that HR staff will become involved in a wide variety of OSH matters, even if they're called something else. So aside from the physical workplace and activities that go on in the name of work, the psychological health of employees is an OSH issue. HR staff may be required to communicate broadly in the case of a death or a serious injury, and often play a crucial support role when managers are dealing with OSH incidents and outcomes. Unexpected situations where an organisation can be thrown into the spotlight for all the wrong reasons can arise in the most unusual circumstances. In a recent court case, an employee was awarded almost $4 million in damages for post-traumatic stress disorder following an attempted murder at work. The employee was only 20 years old at the time, and a colleague tried to throw him off a fourth-floor balcony and violently attacked him. So in that particular case, the actions of the employer, the managers who could have influenced the situation, as well as the types of policies, the disciplinary and behaviour management at the workplace would all have been scrutinised during the case, and we'll talk a bit further about this case as we go through the webinar. So it's time for another poll. Please let us know your answer. How comfortable are you that you know the full scope of the kinds of OSH issues that could arise at the workplace? If you're one of the many people who answered that you are only mildly comfortable with how well you know the extent of the kinds of situations that could arise at your workplace, it is the type of thing to sit down and think about with your management team. Brainstorm the kinds of situations that could occur, although I doubt that even if the management team at the particular employer that we were just discussing with the incident on the balcony would have thought about potential for attempted murder in their workplace. When you're having the discussion with your executive team, the kinds of things to consider are those that you see on the screen now. The new OSH laws will contain a wide variety of different requirements, and it will be a job for someone to go through and identify what needs to happen, what you do currently, and how you fill the gap. Each of those different areas will require a certain amount of attention, and it may be that the business that you're in already has reasonably well established processes which can easily be adapted. If you're not certain that that is the case, or it's not your responsibility specifically to look after that area, it's still important that you are aware of the scope of the changes. And some of the things that are primarily changing really are quite significant when you're considering the management of people at your workplace. So we'll talk about those in a little bit more detail shortly. But the kind of high-level mapping that you'll need to do in relation to each of these particular areas should be able to be identified when you have a meeting with your executive team or your management team to brainstorm the foreseeable risks that could occur in your workplace or the foreseeable circumstances. So if you are extremely comfortable that you have safety and health very well managed at your workplace, it should be a very easy conversation to drop in the areas of change or the areas of monitoring. If you're not quite so comfortable, it's something that you may need to spend some time thinking about. So planning for change really does depend on your business, and there'll be some businesses that need to do a lot to adapt to change legislation, others that really just need to be aware that changes are coming, map out how they're going to adapt, and then take the necessary steps a bit closer to the date. Now, these kinds of changes generally aren't done by one department or one person, and that's part of this planning process. What we are trying to communicate to all of the employers who've signed on to our webinars, but also more generally who we might speak with in the course of our dealings with our members, is that you can't prepare early enough. It really is something that does require a little bit of work at this early point in time to see where you're situated and what it is that you're likely to need to do. Another reason it's really good to think about that at this time of the year is that many businesses are currently planning their budget requirements for the coming financial year. So if that's your business, you'll want to make sure that any changes you're going to need funding for are included in your 2015-16 budget planning. So we have received a question from a participant. Lynn Bentley has asked, as an SME that doesn't have an OSH or HR department, where do you get assistance to brainstorm the possible issues? That is a really good question, Lynn, and depending on how in touch your management team is with what's going on in the world of safety change, it can be a conversation that's hard or that's very easy to have. The reality that we find is that small to medium enterprise generally are very busy focusing on production, understanding their client needs and making sure that those things are delivered on. And there really isn't a lot of time left by the time you do that very well to be able to work out exactly what you need to do and how. CCI does have available a number of pathways to provide support and assistance, and we'll be continuing to provide information around how to have those conversations. We can certainly assist if you need any pointers on how to go down that path, but really the primary things to look at are how comfortable do you feel right now that you've identified those areas of risk? What have you got in place that you could put your hand on if you needed to, that shows what you do and how you do it? And are there any areas for improvement that you could look at for the coming year so that you can implement changes in a structured way? Because if you have nothing in place at the moment or nothing you feel comfortable is strong enough, then it can be quite an overwhelming task. So CCI is always here to assist members and employers, so if you do need any help, please don't hesitate to give us a call, and we'll be more than happy to step you through some pointers on where to get started. In order to cover some specific changes of the proposed work health and safety legislation, a very good place to start is to have a look at the introduction of new and increased responsibilities on senior managers. Now, this is an area that has received quite a lot of publicity, and it has actually created quite a lot of angst within senior managers and even more broadly at the workplace. The intention of the model work health and safety laws was to place responsibility on those decision makers within every business who have the true decision-making power to influence how things are done at the workplace. Senior managers tend to have the most direct influence over the culture and operational norms at a business, so they have a specific responsibility to manage as is reasonable for someone in their position. And it's the same for every other person in the workplace, so what's reasonable for one person in their role will be different to what's reasonable for someone else. The work health and safety legislation introduces specific responsibilities on officers, and due diligence is one of the elements of those responsibilities. So what it specifically says is that officers are required to take reasonable steps to demonstrate that they have exercised due diligence in ensuring that the organisation is complying with its OSH obligations or work health and safety obligations. Due diligence elements include personal knowledge of work health and safety, an understanding of risks that might exist in the particular operations of the business, systems for hazard identification and control, resources, particularly like this one when you're asking for budget allocation. They do have a responsibility to make sure that there are resources, human and otherwise, available to effectively manage safety and health at the workplace, that there are systems in place to ensure compliance, and that there is verification that everything is tracking as it is supposed to. Now, one of the questions I'm asked very frequently at the moment is who is an officer? And we actually did have some questions come through yesterday from people who registered to attend the webinar as to how you work out who is an officer, because there was a time when this legislation was first released when there was a lot of conversation around the responsibility of officers and how you might identify them. At the end of the day, identifying who is an officer is a legal question. Officer is defined within the Work Health and Safety Draft Act as a person who is an officer under the Corporations Act. Generally, that includes your most senior executives, so your Chief Financial Officer, your Chief Executive Officer, directors of the board, people who own the business, those who genuinely have a capacity to influence the financial stability and direction of the organisation. So if you are unsure in your business who would be classified as an officer, we would strongly recommend that you obtain legal advice to work that out. CCI can assist with that if you don't have a legal provider. And essentially it's a case of examining your organisational structure and identifying those people who would fit the definition. Once you have done that, it becomes a question of ensuring how you, in your role as potentially the HR manager or a manager in a different capacity, can support your officers to meet their due diligence obligations, because they will be looking to you and everyone else in your management team for support, for reports about what's going on, and for specific assistance to make sure that the systems are in place and that everyone is following the required pathways to achieve compliance. HR staff are critical when it comes to ensuring that executives are well informed and are educated and are able to deliver on those aspects of work that sit with them. Beyond this, HR staff can influence the culture and operational norms at a workplace too, and often this influence is indirect through leadership, reporting of information, and notably when there are circumstances when termination of an employee may occur after they have reported an OSH matter. So again, we come back to that very clear overlap, not necessarily in relation to how an executive might carry out their tasks or meet their due diligence obligations, but more broadly how an executive might find the organisation has breached its obligations somehow, and will then be asking questions from the different departments that have actually carried out particular activities. So the reason that I mentioned the area of termination of employment is because unfortunately in the current environment we are seeing a lot of inquiries from employers unable to maintain their current workforce and needing to shed employees and thereby potentially terminating employees with a particular entitlement that then could result in a breach either of work health and safety legislation or employee relations legislation, or both. Current requirements, the draft Work Health and Safety Act imposes responsibilities on people who might influence, control or coerce anyone in relation to termination that breaches the discrimination requirements. So what that means is that the actions of HR staff members involved in a termination could potentially be scrutinised if the person later accuses the organisation of having discriminated against them in relation to a safety issue. One area that we often receive queries about in relation to safety and health is social club activities or staff social events. This is an area that many businesses engage in the interest of making it a better place to work, and many staff participate in these kinds of activities thinking it's the normal and expected type of event that should be run by businesses. If you are responsible for coordinating and running events, then potentially there will be safety and health risk in those events, and it will be expected that there will be reasonable care taken in that coordination. So regardless of what your role is, whether you are a safety person or an HR person, if you're responsible for controlling or coordinating an event or activity, this kind of responsibility will sit with you. There's also a duty on particular individual people, so workers at the workplace, to take reasonable care of themselves and others. This applies to HR staff as it does to everyone else. And reasonable care is measured based on what a reasonable person in that position, with that authority and experience, would or should have known. So this duty significance is specifically in relation to HR staff when you're considering how your actions influence the behaviour and actions of others at the workplace. Are you giving managers the right advice? Are you supporting and controlling people with mental health issues, for example? These kinds of areas are not hard safety, but they do have an influence on people's safety and health at the workplace, which is why it's another area of overlap. If we go back to the case with the attempted murder on the balcony, I can let you know that the New South Wales Supreme Court found that the employer had breached its duty of care to the victim in failing to manage the psychotic behaviour of their aggressive co-worker. They didn't act quickly or effectively enough, and through the actions of some other staff increased the danger to the victim. So as a result of that incident, the victim is permanently unable to work and cannot live a normal life. Now, I have no doubt that the employer and individuals involved will carry an awful guilt for inadvertently having allowed this particular event to occur. They inadvertently didn't do the right thing. They had no intention of allowing something like that to happen to their employee or their colleague. However, when something does go horribly wrong, it's always hindsight that makes these situations seem so much simpler. Regardless, it's a tragedy no matter which way you look at it, and it just highlights the kinds of completely unexpected and terrible things that can happen in the workplace. Does anyone have any questions? Thank you. We've had a question from Tim Allard, who's asked, what is the predicted timing of the implementation of the new legislation? The most likely implementation timeframe at this stage is that the consultation draft has actually been reviewed and the consultation period closed at the end of January. A report has been prepared for the Minister and it's expected that a bill will actually be drafted from around April onwards if the Minister's decision is to go ahead with it as drafted. So from then on, the intention would be for it to be introduced early in 2016. We've had another question in relation to reasonable care and whether this is covered under the duty in the legislation. So the primary duty of care in our current legislation, so the current Occupational Safety and Health Act and regulations are what apply in WA for most workplaces. The question around whether or not reasonable practicability sits within the new legislation, that's something that is a fundamental part of the work health and safety legislation package. So exactly as we have currently, there is an expectation employers do what is reasonably practicable to provide a safe workplace, safe systems of work, provide training, information, instruction and direction, consult with staff and other relevant people, and provide personal protective equipment if required. Also, of course, to provide safe plant and equipment. So reasonable practicability continues to be a fundamental principle of the new legislation. We've also had a query through from Kate, asking how would the company have known the person was psychotic? This is in relation to our attempted murder before the incident, and what other reasonable steps could have been taken. Well, the history of this particular case is actually that the person started to exhibit some psychotic behaviour a couple of days before the incident occurred, and actually started to take a particular interest in the victim. He then apparently had a snapping moment when he was outside near the balcony and asked to see the victim, and through a variety of decisions that were made, that person ended up in that vicinity and was therefore on the scene at the time and in a position where he could be pushed against the balcony railing. We've had another question from Angela Smith, which is in relation to staff and social events. What are reasonable steps? For example, do we need to have a particular venue? Do we need to inform people where the exits are? Those sorts of things. That's actually a really good question from a practical perspective, because very often when you hire a venue to run a social event, you rely on the venue to ensure that the place is actually safe for the event to be held, and that the staff there will look after you in case you do need to evacuate, or those sorts of requirements might be needed. So our advice generally is to make sure that when you are planning an event, have a very basic risk assessment process. So even if you sit down together with the people that you're planning the event with, or even if you take a couple of colleagues from your work area, sit down and think about the kinds of things that could go wrong. Map out those things and work out why could they go wrong, what could we do to prevent them going wrong. So if you are working with a reputable venue and they are providing staff to assist in the running of your event, those are the kinds of things that you would note on your risk management plan for that particular event as something that's actually quite reasonable to do. You're not going to want to go and inspect everybody's kitchens. The answer to that is really to think about what could go wrong and to come up with ways of managing those potential risks. And really the very easiest thing to remember is if something is a big risk, provide or give it as much attention as it needs. If it is a low risk, then don't spend too much time on it. Focus on the things that are going to be most risky in the particular activity. Use reputable providers, reputable partners, reputable people to come and deliver things to you, set things up for you. The more that you can demonstrate that you've looked at the risks that may have been involved and put appropriate controls in place, the better it is. It doesn't have to be complicated. Depending on the size of your event, it can be quite simple. Okay, we've had a couple of other questions. If you do have any further questions around events, or you're going to run a particular event and you'd like to talk through how you might best manage it, please don't hesitate to give us a call after the webinar and we can walk you through exactly the kinds of things to look out for and the kinds of things you might want to implement for those events. So we've had a further question in relation to events actually around alcohol and whether or not individual people who might be under the influence of alcohol might be held accountable for their behaviour. Controlling how much alcohol people have at an event is one of your primary risk management strategies. It should be part of every event management plan that you have in place. People should be advised that you have an expectation of their behaviour when they come to events that you organise or invite them to, and you will need to have management presence at events to ensure that things go as planned. There are a variety of different situations that can arise when people are impaired by alcohol, and that's obviously something that you will need to be conscious of in your event planning. So if you're serving alcohol or it will be available, it has to be on your risk management plan. So we did have some further questions, but we're very conscious of time, so we'll come back to those if we can, and otherwise we'll answer them out of session from the webinar. There are a variety of other specific changes that we wanted to flag with you. In particular, one of the major changes within the Work Health and Safety draft legislation is the expansion of the definition of worker. So currently our OSH legislation is very much focused on an employer and employee relationship. There are some provisions around contractors and how you have responsibilities to them, but most of the provisions relate to employer-employee interactions and the kinds of protections you need to have in place for your own employees. The definition of worker within the model work health and safety legislation actually includes volunteers, but the West Australian Green Bill, so the model that we're looking at adopting, doesn't extend the definition of worker to include volunteers. What it does do is extend the definition of worker to cover contractors and subcontractors. What that means on a practical level is that the responsibilities that you have to your employees will extend to that much broader group of people. So when we're talking about providing a safe workplace, safe systems of work, training, supervision, direction, all of those things will extend out to that broader range of people. So it will become very, very important to make sure that you know exactly who your workers are. So just as we said earlier, identify who your officers are. you also need to be very clear who your workers are. So you need to know who is in and who is out of that definition, so you can make sure you're providing the correct level of information and care to those people. Beyond that, the draft legislation also incorporates a specific responsibility to consult with clients, contractors and others about shared risks. Now, that already exists to some extent in our current legislation, but there isn't a specific requirement to be able to demonstrate how you've done that. Under the model legislation and the draft legislation for WA, there is a specific requirement to consult, coordinate and cooperate with the people that you share responsibilities with to the same person. So if you're in a contracting chain, or if you're in a situation where you are the client and you engage a number of contractors who bring their staff to site, you have a shared responsibility, or you each have concurrent responsibilities to those people that come to site. Now, you most likely already manage those risks between you, but are you able to show how you do this, how you split the responsibility, how you've satisfied yourself that what is being done is enough and the right thing? So again, this is something to look at in preparation. It's to sit down and have a think about who are our workers, who are the people that we share responsibility for, and who is it that we share responsibility with for those people, and how do we manage, how we consult, coordinate, communicate and cooperate with those people in order to make sure that those risks are managed well. Are there any other questions at this stage? So following on from the things that we've talked about today, you should now have a to-do list of things to look into. This is a starting point of preparation for the legislative changes. There'll be a variety of issues that you'll become aware of as you follow this process that may require further action closer to the time when the new legislation is going to be implemented. So essentially, you'll need to think about preparing a change management plan, work out who are your officers, who are your workers, measure your current compliance so that if you do need to make changes, you won't have a huge list of them. Update your systems to reflect the changes. Train and educate people to embed the new way of working. We have received some questions around contractors. Now, contractors are a very difficult group of people to classify easily because the relationship that you have with different people at your workplace who are not your employees will vary depending on how you have engaged with them or how you have engaged them. So the definition of worker includes contractors, but contractors as a term is not defined. So what you will need to do is identify who is in your business, why are they there in terms of what kind of arrangement have you got with them, and how should you classify them for the purposes of working out who they are. Now, this is slightly different to the way that you might approach the question of who is your contractor for the purposes of workers' compensation, because the definition of worker in that legislation also includes contractors, but again in very specific circumstances are they covered. So this again would be the kind of issue where we would recommend that you identify who is and isn't a contractor through advice from your legal counsel or your legal service provider by a review of your contracts and working arrangements. Another question that we've received is how can we measure compliance? Measuring compliance is probably easiest done by undertaking a gap analysis or an audit. The compliance analysis that we're suggesting at this stage is an assessment against current legislation to see where you sit right now, because even though there are changes coming, the fundamental principles will be the same under the new legislation. and any changes that you make won't necessarily be to the way that you do things in practice, because the principles are the same. It's more around how you record things and how well you're able to meet the requirements from an administrative perspective that will be coming in under the new legislation. Another question that we've had is in relation to contractors being deemed to be employees. So contractors aren't deemed employees, but the definition of worker, so the Act is moving away from a definition of employees or the reference to employees. The Act is actually, the new Work Health and Safety Act actually has a definition of worker, and worker includes contractor. So your contractors aren't deemed employees, but they are considered workers. So that brings us to the end of the formal content of our webinar. If you do need any further help, or if you need any advice or assistance, please don't forget that CCI members can access free telephone advice about OSH and workers' compensation. I'd also be happy to come out and meet you at your workplace to help you work through these issues, and if any of those are of interest, please let us know. You can either send us through a further question or request, or we will be in contact with you if you flagged any interest or any requests for further information. We'd also like to invite you to join us at our next webinar. We look forward to our next opportunity to show you how much CCI loves HR. Our next upcoming webinar features CCI's Employee Relations Consulting Manager, Jessica Price, when she takes a look at a very different approach to managing work teams. Now, if you have any questions about any of the issues that we've talked about today, please do let us know, and thank you very much for your time. If we haven't answered your questions, we will send you an email or be in touch to answer those questions for you so that you are not left wondering. Thank you very much. Have a great afternoon.